Now, one of the things that I like to do is I like to make sure that we're educating our public well, as far as what to look for. Okay, we're using this word toxicity, a toxic person. And actually, I went onto your website and I picked up a checklist that you came up with so that you could identify a toxic person. I want to go through some of those with you here in just a moment. But when you use that word toxic, as it relates to a person engaging in relational issues, what do you mean by that?
Yeah, clinically, if someone came into the office, I wouldn't diagnose them as toxic. I would say that they had some form of a personality disorder, probably. Like maybe they are higher on the narcissism scale, or maybe they're showing a lot of antisocial personality disorder problems. Maybe they might even have some borderline personality features, but there's not really a good general word to capture the difficulties some people have with managing normal ego functions, normal things like showing good judgment or having restraint or knowing how to deal with emotions. So, toxic to me is just a nice way of capturing a group of people that may not have had their egos matured quite to the point that would make them easygoing or cooperative or a good team player.
I use the term the false self, and that's a very common term we use as we discuss the narcissist. And just listening to you, would it be fair to say, and I'd like to hear your comments on this, that that this toxicity begins very early on in that individual's life? They've learned that they can't afford to be real or authentic or seek out help, and so they have to compensate for all of that. I mean, where do you see as some of the origins of this as being?
Yeah, that's a great question. I don't think we have the final answers on this. I was able to hear Dr. Gregory Lester this last year in a continuing education course, and he was one of the DSM-5 committee members uh, analyzing the traits of a personality disorder and what should belong in the DSM-5 and what doesn't. And he says that it's a biosocial problem, that there's a high rate of concordance among twins of narcissism. I think it's upwards to close to 70% of twins will have narcissistic traits. But yet there's also a social component, the sort of a nurturing component, not just a nature component. So I'm not for sure exactly what the combination is or what triggers it in some people, but I was trained in more of a developmental model, meaning that I see people from infancy to adulthood, and that for some of us, things that should have occurred, like learning how to manage anger, or learning how to deal with really being sad, or learning how to say no to something we really want to do or don't want to do. But for some of us, we don't fully mature in those areas, and we have areas of weakness. I almost see it like a continuum of weak to strong, and some of us are really strong, maybe with showing insight into ourselves, and others are super weak. Maybe we're very empathic. Some of us are very empathic. Others of us may be very weak. Some of it's, I think you can also refer to this emotional intelligence as an
Oh,
EQ
very much,
issue.
yeah.
Yeah, that some of us have really low EQs. The false persona, that the way what you were referring to, gets developed, I think, in some of us as a way to manage the shame. If we're weak and we know that maybe we can't show up quite in the way that seems to be quote unquote normal, we might then develop a self that we think others want to see, at least makes good first impressions, without realizing that you can't build a relationship on that's not going to last very long.
You used the word shame, which is a word that many of us in the profession will use. One of the presumptions that I make is that whether it's conscious, and usually it's more subconscious, deep down on the inside, narcissists carry what I refer to as their own self-loathing.
Hmm.
Now, the vast majority of them would just roll their eyes and say, Carter, I don't know what you've been smoking, but no, that's not the case at all. In fact, they come across as being very impressed with themselves, etc. But then when we think, well, wait a minute, if you're so impressed with who you are, why do you have to cover everything up?
Yeah.
And why are you so absurdly defensive? And why do you have to deflect when someone says, hey, let's talk about something? And it can be something so simple, and they're extremely thin-skinned, etc. And the answer, at least to me, and I suspect to you, is they don't want anybody to know who they really are. They
Yeah.
don't want anybody to know what their hurts and pains and difficulties are. That's what I refer to as the self-loathing, but they want to maintain this veneer that says, I've got it together. Of course, you don't, but I do. I mean, is that consistent with what you see as part of this toxicity?
I do. I do. I think there are, all of us have a core of shame. I think that's just sort of a developmental stage that we have to do something with. I mean, I was thinking of Erickson's second stage of autonomy versus shame, and
Yes.
it's an essential, and it's one of the emotions that we experience is the most difficult to process. It undoes us. We really dislike it. I think it's a challenge for all of us to manage. But I also think there's a second group, though, that gets mixed into the narcissistic group, and that's the antisocial personality disorder group. I don't think that they feel a lot of shame. That group, I think, is a little more callous, and I think at their core is it's been theorized they're more empty there, or I experience them as more bored, restless. They just feel flat. There's not a lot of joy, not a lot of pleasure in their life, and so they're more pleasure seeking, and they'll do hurtful things to sort of get a rush. But yeah, the narcissist to me is trying to hide, and then the antisocial personality disorder is trying to get a thrill. And then you get the group who sort of sits in between both of those and is managing both issues.
Okay. Some are trying to hide, some are trying to get a thrill.
Hmm.
I love the way you put that. And bottom line is they're constantly in compensation mode.
Yes.
When you say empty on the inside, there's just something that's missing there.
Hmm.
And then they're seeking that narcissistic supply. You exist to make me feel better right now.
Yes, exactly, exactly. They're both of them don't have their scaffolding inside to cope with these uncomfortable feelings. So the way that they cope with them is they address it externally with us, in relationship with us, which
Okay.
then becomes a problem of us who's around them.